It's 7 o'clock in the morning. The coffee is poured, the kitchen is quiet, and you reach for the little orange bottle you've reached for 1,000 times before. One pill, a sip of water. Done. You don't even think about it anymore. It's just part of the morning, like brushing your teeth. And why would you think about it? Your doctor prescribed it. The pharmacy fills it. Your numbers look fine, so you swallow it and get on with your day. Here's what nobody stops to tell you. In the United States, tens of millions of adults over 50 take one of 3 diabetes drugs every single day: Metformin, Glipizide, or Januvia. 3 of the most prescribed medications in the entire country. And the overwhelming majority of the people taking them have never once been told what these drugs quietly do to the rest of the body over the years. Not the pancreas, the rest, the nerves, the kidneys, the vitamin levels, the heart. This is not a conversation you are going to have at your next appointment, not because your doctor doesn't care, but because a 12-minute office visit does not leave room for it. There is time to check your sugar, renew your prescription, and send you on your way. There is no time to explain what happens downstream. So let me be clear about what this is and what this is not. I am not here to scare you off your medication. These drugs save lives, and stopping them on your own can be dangerous. What I am here to do is make you the most informed patient in that waiting room, because the patient who understands their own treatment is the one who stays safe. Let's begin. Here is the first thing almost nobody understands. Diabetes medication is not one thing. When 3 different people say they take a pill for their blood sugar, they may be taking 3 completely different drugs that work in completely different ways. And that difference is not a small detail. That difference is the entire story, because when drugs work differently, they also fail differently, and they carry entirely different risks. Let me walk you through all 3. The first is Metformin, a biguanide, which is simply the family of drug it belongs to. Think of Metformin as a quiet word with your liver. Your liver stores sugar and releases it into your blood throughout the day. In diabetes, it releases too much. Metformin taps the liver on the shoulder and says, "Ease off." It doesn't force anything. It just turns down the tap. The second is Glipizide, a sulfonylurea. This one works in a completely different place and in a completely different way. Glipizide goes to the pancreas, the organ that makes insulin, and it presses the accelerator. It whips the pancreas into pumping out more insulin, whether your body asked for it or not. Hold on to that phrase, whether your body asked for it or not. It matters more than you think. The third is Januvia, a DPP-4 inhibitor. Instead of squeezing the pancreas directly, it protects the natural blood sugar hormones your own gut already makes, so they last longer and work harder. A gentler approach, generally. But gentle is not the same as harmless. 3 drugs, 3 completely different mechanisms. And here is the point that changes everything. Advice that is perfectly safe for one of these can be genuinely dangerous for another. So the question is, no longer do you take something for diabetes? The question is which one and why. Let's start with Metformin, because it hides something in plain sight. Metformin is one of the safest, most trusted diabetes drugs ever made. But there is a side effect that is thoroughly documented in the medical literature and almost never mentioned across the pharmacy counter. Over years of use, Metformin quietly drains your body of vitamin B12. B12 is not optional. It builds the protective coating around your nerves and helps make the red blood cells that carry oxygen to your brain run low, and the consequences are specific. Numbness and tingling in the hands and feet, a foggy, forgetful mind, deep fatigue, a wobble in your balance you can't quite explain. Now here is the cruel twist. Read that list again. Every one of those symptoms gets blamed on something else. The tingling in your feet, that's your diabetic neuropathy, they say, meaning nerve damage from diabetes itself. The forgetfulness, the tiredness, the unsteadiness, well, you're not 40 anymore. So picture yourself. You mention the numbness at your appointment, you get a nod and a sentence about neuropathy. You go home and accept it. A year passes, 2 years, passes, 2 years. The whole time, the real culprit was a vitamin your own medication was washing out of you, and nobody thought to look. Here is the good news, and it is genuinely good. This is one of the easiest problems in all of medicine to catch and to fix. A simple blood test measures your B12 level. That's it. And if you're low, the correction is a supplement, or in some cases a short series of injections. The deficiency reverses, the nerves can recover. If you have been on Metformin for more than a few years, this is a number worth knowing. Now to Glipizide, and the risk that seniors underestimate more than any other. Remember that phrase I asked you to hold on to? Glipizide forces your pancreas to release insulin whether or not your body asked for it. That is the danger in a single sentence. Insulin's whole job is to pull sugar out of your blood. So when glipizide pushes insulin out but there isn't enough food coming in to match it, your blood sugar doesn't just settle, it crashes. Doctors call this hypoglycemia, a low, and it doesn't take anything dramatic to trigger one. A skipped meal, a smaller appetite than usual, which is common as we age. A busy afternoon where you simply forgot to eat. Here is what makes this so dangerous in an older body. You've probably heard that a low feels like shakiness and a cold sweat. In a younger person, yes. But after 65, a low often wears a disguise. It shows up as sudden confusion, as weakness that comes out of nowhere, as a stumble or a fall, as a foggy, just not right feeling that you or the people around you brush off as tiredness. The alarm bell that's supposed to warn you gets quieter with age, right when you need it most. And the most dangerous time of all is while you sleep. A low at 3 o'clock in the morning can unfold with no one watching and no warning you'll remember. Two things make it worse still: skipping meals and aging kidneys, which clear the drug more slowly so it lingers and stacks up. So the guardrails are simple. Never take glipizide on an empty stomach. Eat on a schedule. Keep fast-acting sugar within reach. And if you're having lows, that is a conversation to have this week, not next year. Now to the third drug, Januvia. And Januvia comes with a different kind of danger, the danger of being too easy to ignore. Metformin and glipizide announce themselves. Januvia rarely does. It's generally well tolerated, causes few obvious problems day to day, and that is exactly why patients almost never question it. But quiet is not the same as harmless. There are 3 things you need to know. First, joint pain. Januvia and drugs like it can cause aching in the joints that is sometimes severe enough to be mistaken for arthritis. People suffer with it for months, never once connecting it to the pill. Here is what almost no one tells them: it is reversible. Stop the drug under your doctor's guidance, and the pain very often fades. Second, the pancreas. Rarely this class of drug can inflame the pancreas, a condition called pancreatitis. The signal to know is severe abdominal pain, often boring straight through to the back, sometimes with nausea and vomiting. That is not a wait-and-see symptom, that is a same-day phone call. Third, and this is the one that ties everything together, Januvia's dose must be adjusted for your kidney function. If your kidneys have weakened, the standard dose can become the wrong dose. And there it is, the revelation underneath all 3 chapters. Metformin quietly depends on your B12. Glipizide and your kidneys decide how hard your lows hit. Januvia leans on those same kidneys. Every one of these drugs quietly depends on organs you are probably not having checked. Your kidneys, your B12, your heart. You know that now, and you can't unknow it. You just learned something important about your own medication. So now what? The honest truth is that most people won't do anything with it. They watch, they feel a little concerned, and by tomorrow they're right back in the same routine. You don't have to be one of them. If you take any of these drugs, what you need is regular screening, kidney function, blood sugar patterns, and your heart. And you deserve to know what newer treatments and clinical trials might be open to you. That's what Care Health does. It's a free platform that connects you with screenings, healthcare options, and clinical trials for new diabetes treatments right in your area. You fill in a short form. It takes about 30 seconds, no cost, no commitment, and it matches you with options near you. Click the link in the description or open your phone's camera and point it at the QR code on the screen. As your doctor, this is the next step I'd point you toward. Now, back to what you need to know about these medications. I told you all 3 drugs lean on the same organ. Let's talk about it directly, because your kidneys are the hinge that this entire story turns on. Your kidneys are your body's filter. Everything in your blood, including medication, passes through them to be cleaned out and cleared away. And here is the part that catches so many people off guard. After 60, kidney function very often begins to decline, and it does so silently. No pain, no obvious symptom. You feel completely normal while the filter slowly weakens. You would never know unless someone checked. Now watch what that quiet decline does to each drug. Metformin is cleared by the kidneys. When they slow down, metformin lingers in the body longer than it should and builds up. In significant kidney impairment, that buildup raises the risk of a rare but genuinely dangerous complication called lactic acidosis, acid accumulating in the blood. It is uncommon, but it is serious, and weakening kidneys are what open the door to it. Glipizide gets more dangerous too. Remember those lows? When the kidneys can't clear the drug efficiently, it hangs around, and the lows go deeper and last longer. And Januvia, as we covered, simply needs a lower dose once the kidneys weaken. So here is the takeaway, and I want you to hold it as tightly as your blood sugar number itself. A kidney function test, a simple blood test, often reported as your eGFR, is not optional maintenance for someone on these drugs. It is the single most important number you have besides your blood sugar. If you take Metformin, Glipizide, or Januvia and you don't know your kidney number, that is the gap to close first. Now I want to tell you something that runs against almost everything you've been taught, and I need you to hear me out. For years, the message has been the same. Get your blood sugar down. Lower is better. Keep those numbers tight. And for a younger person newly diagnosed, that is often exactly right. But somewhere along the way, that message hardened into a rule that gets applied to everyone, at every age, no matter what. And for many older adults, that rule quietly does harm. Here is the problem. The tight target set for a healthy 40-year-old can be the wrong target for a frailer 75-year-old. When you push an older body's blood sugar too low with aggressive medication, you invite the very danger we've been discussing, the crashes, the confusion, the falls, and a serious fall in later years can take more from you than the diabetes ever would. You can be so well controlled on paper that you become unsafe in real life. Doctors have a word for easing back on treatment when the risks start to outweigh the benefits. They call it de-intensifying, carefully reducing or simplifying medication under a doctor's guidance. And I want to be clear about something. This is not failure. This is not giving up. This is good medicine. Targets are supposed to loosen with age and frailty, because the goal was never a perfect number on a lab sheet. The goal was always a longer, safer, better life. You are not equipped to make that change on your own, and you shouldn't try. But you are now equipped to start the conversation. Ask your doctor a simple question. Given my age and my health, is my target still right for me? Up to now, we've looked at these 3 drugs one at a time, but that is not how they live inside your body. Very few seniors take just one pill. Open the average medicine cabinet after 65, and you'll find a blood pressure pill, maybe a heart medication, something for cholesterol, perhaps a steroid for a flare-up, and a handful of over-the-counter products picked up along the way, and every one of those can reach over and collide with your diabetes medication. Let me show you how. Some common blood pressure and heart medications can deepen a low, or worse, mask its warning signs, quieting the very alarm bells that are supposed to tell you your sugar is crashing. Steroids can send your blood sugar swinging in the other direction. And certain everyday painkillers, the kind you'd never think twice about, can strain kidneys that are already the weak point in this whole system. Nothing here is exotic. These are ordinary items sitting in ordinary cabinets, quietly interacting. Here is the trap. Your cardiologist knows what your cardiologist prescribed. Your primary doctor knows their list. The pharmacist sees pieces, but often, no single person is looking at the whole board at once, and the collisions happen in the gaps between them. So here is the practical rule, and it is genuinely powerful in its simplicity. Write down everything you take, every prescription, every supplement, every over-the-counter product, with the doses. Carry that list in your wallet and put it in front of every doctor and every pharmacist you see. That one piece of paper closes the gaps. Taking many medications is not something to fear. It is something to manage, and you can only manage what you can see. This is how you see the whole board. Now I need to slow down and be very clear, because this next part could genuinely save a life. Most of what we've discussed is about the long game, knowing your numbers, having the right conversations, but there are a handful of symptoms that are not for later. They mean pick up the phone today, or call for help now. Let me give them to you plainly. First, the signs of a severe low. Not just feeling a little off, but real confusion, slurred speech, someone unable to be woken, or a low that won't come back up even after eating sugar. That is an emergency. Second, and this one is tied to metformin. If you develop deep fatigue with unusual muscle pain, weakness, and rapid heavy breathing, sometimes with vomiting, take it seriously. That combination can be a sign of lactic acidosis, the rare complication we talked about. Do not wait it out. Third, severe abdominal pain that bores through to your back, especially with nausea and vomiting. As we covered, that can signal pancreatitis. That is a same-day call, not a next-week appointment. And fourth, any new confusion, a sudden change in alertness, or a fall. In an older adult on these drugs, that is never just one of those things. It deserves a look. Now, I don't tell you this to frighten you. These events are uncommon, and most people on these medications will never see them. But uncommon is not the same as impossible, and the difference between a scare and a tragedy is almost always how early someone recognized what was happening. Knowing these 4 signs is exactly the kind of awareness that saves lives. Keep them somewhere you'll remember. After everything we've covered, I don't want you to feel powerless. I want you to feel the opposite, because the truth is, you have far more say in how these drugs treat you than you have been led to believe. Let me hand you the levers that genuinely move the needle. Start with your meals. If you take Glipizide, eating on a consistent schedule is not a suggestion, it is protection. That drug needs food to work against. Give it something to work with, and you take away most of its danger. If you've been on Metformin for years, have the B12 conversation. One sentence at your next visit. Should we check my B12? Can catch a problem that's been hiding for years. Know your kidney number. If you remember nothing else, remember that. Ask what your eGFR is, and ask what it means for your doses. And do not underestimate movement and food as medicine in their own right. A daily walk, a plate with less sugar and more real food, these are not soft advice. They lower blood sugar directly, and over time they can change how much medication you need at all. Then bring a short list of questions to your next appointment. Just 4. Is my target still right for my age? What's my kidney number? Should we check my B12? And is anything on my list interacting? Those 4 questions turn a rushed visit into a real one. Here is the heart of it. The pill is a tool. It is not the whole toolbox. You are holding more of the tools than you realized. So let's bring it all together. 3 drugs: Metformin, Glipizide, Januvia. 3 completely different mechanisms and 3 completely different risk profiles. Metformin, the quiet B12 thief. Glipizide, the one that can send you crashing if there's no food to catch you. Januvia, the gentle one that still leans on your kidneys. But underneath all 3 sits a single truth, and if you take one thing from this, let it be this: the danger is almost never the pill itself. These are good drugs, and they save lives every single day. The danger is everything around the pill that goes unchecked. The kidney number nobody looked at, the B12 nobody measured, the low that got blamed on old age, the medicine cabinet nobody laid out on one table. So here is your week. Find out your kidney number. If you're on Metformin, ask about B12. Write out your complete medication list and put it in your wallet. Eat on a schedule and bring those 4 questions to your next visit. None of that requires a prescription. All of it is within your reach. And remember, that free health screening link is in the description. 30 seconds could make a real difference in how these medications work for you. Take care of yourself. Because this is exactly the conversation your next appointment won't have time for. That's precisely why this channel exists, to give you what the system doesn't have the 12 minutes to explain.